It's been known that there are good treatments for things like nasal obstruction, for sinuses, for sinusitis, and unfortunately Dayquil has never really fallen into the category of high quality evidence. I've always had a sneaking suspicion that it won't really do anything. A couple of documents or guidelines that we follow, actually I'm responsible for updating that guideline. They've come up with a consensus statement basically saying what's good for nose therapies, what are the options, and what has evidence and what has little evidence, what has no evidence. And the reason is because of the mechanism of how the nose works. When there's swelling in the nose, we need to kind of calm down the swelling. Certain medications like intranasal steroids or steroid sprays such as Flonase, there's non-steroidal sprays like azolastine. They'll shrink down the tissues of the nose and really help with breathing of the nose. Fortunately, Dayquil doesn't really work that way. The standard of care for nasal obstruction initially is intranasal steroids and antihistamine sprays such as Flonase and azolastine. And they work because of the mechanism of action. They shrink down the tissues of the nose, making it easier to breathe and to get air in the nose. Some of it's tincture of time. Your body just needs to get rid of the viral infection. Unfortunately, as much as it's unpleasant at that time, your body will eventually get rid of it. But at the time of the cold, we can try things like nasal saline. It's just basic saltwater sprays or irrigations that washes out mucus and helps you breathe better. So there are alternatives that are actually cleansing for the nose that work. Things that we can also try are intranasal steroids. Steroids kind of shrink down the swelling in the nose and allow for the nose to be open and to drain its mucus. Other things that we try are things like Afrin, although I will give a cautionary tale with Afrin. Afrin is not to be used longer than 3 days because there's the additive effect of congestion after 3 days. So Afrin with a huge caveat.